Are your Social Security benefits in danger? The Social Security Administration has just announced a controversial new rule that could leave up to 170,000 beneficiaries without their monthly payments. If you or someone you love depends on these benefits, in the next few minutes, this comprehensive explanation could save you thousands of dollars and countless headaches. Has the government gone too far with these new restrictions? What exactly has changed? Who is most at risk? And, most importantly, what can you do right now to protect your benefits? Before we dive into the details, please subscribe and turn on notifications so you never miss critical updates about your benefits. Also, leave a comment below with any questions you have about this new rule, and I will do my best to answer them in my next video. Now, let's get into what this rule change really means for Social Security recipients across America. When the Social Security Administration makes changes to its policies, millions of Americans hold their breath. The latest rule revision, which takes effect next month, has created a wave of anxiety among beneficiaries, and for good reason. This change specifically targets continuing disability reviews and income verification procedures, potentially affecting approximately 170,000 recipients who might suddenly see their benefits suspended or terminated. In addition, the new regulations seek to tighten the eligibility process by enforcing stricter review schedules and documentation protocols. The Social Security Administration is implementing a more rigorous enforcement of its medical improvement review standard. Under this new approach, beneficiaries classified as medical improvement expected or medical improvement possible will face more frequent reviews and stricter documentation requirements. The administration argues that these measures are necessary to reduce fraud and ensure that benefits are awarded only to those who truly qualify. However, critics assert that this approach creates unnecessary barriers for legitimate recipients who already struggle with significant health challenges. You might be wondering, who falls into these categories? Typically, these include individuals with certain mental health conditions, musculoskeletal disorders, and some autoimmune diseases where symptoms can fluctuate unpredictably over time. The challenge is that while some conditions may show temporary improvement, they remain chronic in nature. For instance, an individual might have one good month, followed by several difficult ones. Yet, if their review occurs during the brief period of improvement, they could lose the benefits they desperately need. Consider Sarah, a 54-year-old former nurse with fibromyalgia, who has received disability benefits for the past 8 years. Under the old rules, she was reviewed every 3 years. However, with this change, she will face evaluation every 18 months, including a more comprehensive medical examination. For someone who struggles with chronic pain and fatigue, the extra appointments and exhaustive documentation requirements create a significant burden, both physically and emotionally. The financial implications of this rule change are profound. When benefits are suspended during the review process, recipients are forced to make nearly impossible choices between medications, housing payments, and basic necessities. For many, the average monthly benefit of $1,470 represents their entire income. So, even a temporary disruption can trigger a cascade of financial crises, from which recovery is extremely difficult. What is particularly troubling is the strict timeline imposed on beneficiaries. Once flagged for review, they have only 10 days to respond to notices and begin gathering the necessary medical documentation. This compressed schedule creates nearly insurmountable challenges, especially for those with cognitive impairments, limited mobility, or restricted access to healthcare services. How can someone with severe depression or physical limitations be expected to coordinate with multiple medical providers, complete complex paperwork, and potentially attend new examinations within such a short time frame? Another concerning aspect of the new rule is the increased reliance on consultative examinations, conducted by SSA contracted physicians, rather than a beneficiary's own treating doctors. These one-time evaluations often fail to capture the full scope of a person's disability, particularly for conditions with fluctuating symptoms. A brief 45-minute appointment simply cannot provide the same nuanced insight as a long-term, trusted relationship with a physician who has monitored the patient's condition over the years. Statistically, the most at-risk individuals are rural beneficiaries, those with limited education, and people without strong support systems. Without advocates to help navigate this increasingly complex review process, many will simply fall through the cracks of a system that seems designed more to challenge them administratively than to assist them medically. And, while there is a process to appeal these decisions, the new rule also complicates this avenue. Beneficiaries can request reconsideration and, eventually, a hearing with an administrative law judge. But the current backlog for these hearings averages 14 months. During this waiting period, benefits remain suspended unless the recipient qualifies for continuing benefits, which themselves require additional paperwork and approvals. To put this in historical context, this is not the first time the Social Security Administration has attempted to tighten eligibility requirements. In the early 1980s, a similar push led to approximately 490,000 people inappropriately losing benefits, and the backlash was so severe that Congress eventually passed legislation to restore many benefits and reform the review process. Many now wonder if history is repeating itself. The Social Security Administration defends these changes as necessary for fiscal responsibility, projecting that the new rule will save approximately $28 billion over the next decade. Yet, critics argue that this saving represents less than 3% of projected Social Security expenditures over that period, a saving hardly worth the human cost of benefit disruptions for some of our most vulnerable citizens. So, what can you do if you are concerned about how this might affect you or someone you care about? First, ensure that your contact information with the Social Security Administration is current, as many beneficiaries lose benefits simply because they do not receive the review notice. Second, maintain regular visits with your treating physicians and make sure they are documenting your condition thoroughly, even during periods of relative improvement. This contemporaneous medical evidence is your strongest protection. It is also wise to consider consulting with a disability advocate or an attorney specializing in Social Security law. Many of these professionals offer free initial consultations and only charge fees if they successfully help you maintain your benefits. They are well versed in the nuances of the review process and can assist in ensuring that you meet all deadlines and documentation requirements. If you receive a continuing disability review notice, respond immediately and begin gathering your medical records without delay. Request that your doctors provide detailed letters explaining how your condition continues to limit your ability to work, even if you have experienced some improvement. For those who face a cessation of benefits, request reconsideration within the 10-day period and explicitly ask for benefit continuation during your appeal. Be aware that if you ultimately lose your appeal, you may have to repay the benefits that continue during this period, so consider this option carefully. Additionally, do not underestimate the value of community resources. Local legal aid organizations, disability rights groups, and even some senior centers offer vital assistance with Social Security issues. It is important not to try to navigate this complex system on your own if you do not have to. Congressional representatives often have dedicated staff to help constituents with Social Security problems. So, if you have followed all proper procedures and still face difficulties, reaching out to your representative's office might help resolve the issue. Looking at the bigger picture, it is reasonable to question whether this approach truly serves the intended purpose of ensuring program integrity.